second session that I have in this course, and we want to talk about international organizations that are working in the field of health, and specifically we want to talk about World Health Organization, or WHO. I'm sure that you have heard about this organization. So we want to talk about the structure and history of WHO, and a brief introduction to this organization, and then some of the roles of the WHO in all countries, and in Iran, as an example, it's the same maybe in the countries around us and in your countries. It's probably the same. Okay, this is the headlines that we want to talk about. Okay, you all know UN. What is UN? United Nations. You know the United Nations, and the United Nations has various organs. You have heard about the organs of the United Nations. I think in the first session we talked about this concept that health is multifactorial and there are many factors that are influential on health at various levels. So when you want to control health problems, when you want to promote health at community level, you need to work in an intersectoral format. And I think we talked about, I cannot remember, you can tell me, I asked this question from the students that, do you know, can you name just one organization that is not related to health at all? In your country, for example. Is there any organization, authority, that is not related to health at all? Can you name one? The purpose of this community is to promote education, yes? And we all know that health status of people is related to their education level. It's a fact, not a fact, but a finding from various studies that people at higher levels of education, they usually benefit from better health. Okay? So it's related. Anything else? Without any relation to health? Relation to health. Because health is something that is affected by various factors at various levels. So any organization working at community level, if you name, we can find a relationship with health. Okay? You can try. If during the session then you remember something that you think that it is not related to health, you can name it and we can discuss. Okay, so this is true also for UN organs. All the UN organs, they have some relationship with health. What it is, direct or indirect. Some of the organizations are directly related to health, some of them are indirectly related to health, okay? And there are some specific aspects that we will talk about them. So the organs that play a direct role in health development, of course at the top is WHO, World Health Organization, yes? And then, for example, we have United Nations Children Fund, UNICEF, you have heard about it, and it's clear that how it is related to health, because it tries to raise funds for children, for the situation, for the status of children in some parts of the world. So, of course, health is an important aspect for the children. We want to promote the health among the children all over the world. Then, United Nations Population Fund, UNFPA. We know about the population and its relation to health. We want to promote the population's health. So, of course, this organ is directly related or has direct role in health or health promotion. Then United Nations Educational, Scientific and Cultural Organization, again UNESCO, it is because it talks about education, it talks about science, it talks about cultural aspects. Cultural aspects are important in health. Yes. So these are these are, for example, these organizations can be named as those who are directly related to health, but there are other organs you can see along this here. These organizations, they have indirect role in health development. For example, UNDP, which is United Nations Development Program. Development is a core concept in all communities, in all countries. And you know that the status of health in developed countries usually is better than those in developing or underdeveloped countries. Yes? So development is related to health. The Office of the United Nations High Commissioner for Refugees, the health of the refugees is important. United Nations Environmental Program, you know that, if you remember from our first session, that we talked about various dimensions of health, and one of them was societal health. One of the dimensions of health was societal health. So the health of an individual is related to the environment, the society that he or she is living in. Okay, so UNEP again is an important organization regarding health. Then World Bank Group, it provides the countries with funds, with budget, in order to promote their infrastructure and development of the countries. And through this way, it indirectly promotes health in the countries. International Labour Organization, again, there are many discussions about labor, health, and work-related problems, occupational health. Yes? Then World Trade Organization, again, for example, working on foods. If you, for example, put some taxes on foods, the core principle in health promotion is that you should subsidize healthy foods and put taxes on unhealthy foods. This is something related to WTO, World Trade Organization. Organization of the Prohibition Chemical Weapons, okay, I think it's clear why chemical weapons are related to health. Food and Agriculture Organization of the United Nations, FAO again, or FAO, you can imagine that how it is related to health, agriculture, it's related to diet, nutrition. Then World Food Program again, providing food for some underdeveloped countries, and help development of health, promotion of health. So, you can name maybe some other organs. The concept is that all these organizations have direct or indirect roles in health promotion. And it is true for the organizations at your country level. You can think about it. You can find these relationships, okay? But regarding the WHO and the history of WHO, the constitution of the World Health Organization was signed by all 51 countries in 1946. This is the date. And then the constitution formally came into force on the first World Health Day on April 7th in 1948. And it was ratified by the 26 member states. So after the UN was formed, then one of the organizations under the UN was WHO. And WHO has some regional offices. You can see the map of the regional offices in this picture, and as you can see, there are 6 regional offices. And by the color, you can see, for example, the African region here, and the headquarters is in Congo here. Then the Americas here, you can see North America and South America, and the headquarters is in Washington, D.C., USA. Then Europe, with the green color you can see, and the headquarters is in Copenhagen, Denmark. Then the Eastern Mediterranean, our region, this is our region, Eastern Mediterranean. And the north part of the Africa, Middle East and north part of the Africa. This is Eastern Mediterranean headquarters. And the headquarters is located in Cairo, Egypt. I think in this class all the countries are here, yes? Is there any other country?
I am in the green.
Sorry?
I said I am in the green.
You are in the green. So which country is Europe?
Turkey.
Turkey, okay, Turkey, yes. Very good, okay, so we have one from the other. Turkey. Okay, but Turkey is here, yes?
This green one.
This one?
Yes.
Okay. Are you sure? Because this is yes, you are right. Yes, because I see the map from this view, so I cannot place the countries in the place. Okay, so you are from Turkey and from the green. Okay, from the Europe region. So in addition to these headquarters that you can see here, the list. In each country, there is an office of WHO. For example, in Iran, WHO has an office. It is in the building of the Ministry of Health. The office in each country. And this is the roles of the WHO in public health, providing leadership on matters critical to health and engaging in partnership where joint action is needed. Because of the experience of this COVID-19, I think all of us are now are somehow familiar with these tasks, with these roles, because we could see that. We could see how WHO worked during the COVID-19, and it helped. The WHO tried at that time to control the disease at the international level by doing something, for example, some joint action. For example, regarding the vaccine, regarding information circulation. If you remember, there was some information circulation by WHO. Every day, or for example, every other day, they had an announcement that, for example, this is some new findings, because it was the COVID-19 infection was an unknown disease. So they try to circulate all the new information about this disease to all the state members, to all people in all over the world. And some other tasks that, if you think about that period of time, you can remember that what they did during that pandemic. Then the other role is shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge, as I told you. Setting norms and standards and promoting and monitoring their implementation, articulating ethical and evidence-based policy options. Because you know that health is a political issue. Okay, so all the policies that are set in any country has some effect on health. So WHO tries to help countries in order to develop healthy policies. Yes, and for example, evidence-based policy options. If there is a policy developed in a country and there are some evidences that this policy is good for health, then WHO tries to circulate this to other state members and inform them that, for example, you can do this at political level, and then the health of your community will be promoted. Then providing technical support. Sometimes it provides technical support for the countries. For example, catalyzing change and building sustainable institutional capacity. For example, by training, because in some countries there are shortage in health professionals or technical people, those, for example, who are good at health promotion. So WHO tries to train people in this field and send them to various countries. in order to promote the health. Then monitoring the health situation and assessing health trends. You could see that in the pandemic kit, that they said that, for example, today in all over the world we have some deaths due to COVID-19, and this is the statistics, and this is a trend, for example, during the past month, and we are now, for example, have a declining trend or increasing trend. It is alarming or it is good. These are the things that WHO is doing. Yes, in public health. This is in Farsi, so we can forget about it. But regarding the technical supports, because one of the roles was technical support, as you could see here, technical support here, technical support. And here's the areas of technical support. It's regarding experts, as I told you, sending experts to countries in order to do something there. Then education, sometimes it trains people from the country. Not sending an individual from another country, but training the professionals of that country. It's education. Then equipments and infrastructure. It tries to provide infrastructures for countries. Then research, as I told you, trying to circulate research, trying to stimulate public health research. For example, if you think about the research, dental research in your country, if you are familiar with that, you can see that many of the research that are done, for example, in the field of dentistry, they are not in the field of public health. They are just, for example, working on biomaterials. They are good, of course, they are valuable. But if you want to think about the public health, promotion of health at community level, we should put force on public health research. Then WHO tries to stimulate this in the countries. For example, guidelines for setting priority for the research. Of course, we should set priority because the resources are limited. We have limited resources for research. And if we spend all of that in some high technical biomaterial and so on, then we would forget about public health. So we should put priority. For example, public health is the top priority, and after that, if there is anything left, then we can spend that on other fields of science and health science. Then some meetings, for example, in November 2024, the first global oral health meeting was held by WHO in Bangkok, Thailand. Because WHO recently, in recent years, developed a global oral health policy action plan. This is an important document. I recommend you to search this document, Global Oral Health Action Plan by WHO. This is the first comprehensive document talking about oral health. As oral health professionals, you should be aware of that document. What it's talking about. You can find it, it's available in the website of WHO, and you can read it, go through it. And it would be good for you to know about that. So the first global oral health meeting was held in November 2024, and they, in this meeting, the Bangkok Declaration was developed and announced. You can again search for that, Bangkok Declaration for Oral Health. It was a very good meeting from all member states. They wanted the chief dental officers to come to Bangkok, and also those people in Ministry of Health around the world that are working on universal health coverage. We will talk about universal health coverage. And there was some discussions, there were some meetings, panels, and they tried to help countries to develop a roadmap for oral health. That was a very valuable thing that they did in that meeting. Then information communication, circulating information, evidence-based knowledge. These are the technical support that WHO is providing for countries. So WHO tries to promote health, to keep the world safe and serve the vulnerable. The goal is to ensure that 1 billion more people have universal health coverage. What is universal health coverage? Do you have any idea?
International.
Sorry?
It's international.
International? No. The universal coverage is the basic package of healthcare that every individual in each country should receive it without any financial barrier. The basic package of healthcare that anybody in any country should receive without any financial barrier. This is the responsibility of the government to provide this package, provide these services for every individual in their country. This is UHC, Universal Health Coverage, because you know that health is a right. Okay, not a benefit, it is a right. So all the people, vulnerable people, poor people, they have the right to receive some health care. And the basic one that should be provided free of charge or subsidized at a very low price is called universal health coverage. So WHO try to provide the people, 1 billion more people with the universal health coverage to protect 1 billion more people from health emergencies. You know that we have emergencies, earthquakes, war, anything else, flood. So at these occasions, WHO tries to get the situation, make the situation better by helping the countries that are, the areas that are affected. And then provide a further 1 billion people with better health and well-being. These are the goals of WHO. Regarding universal health coverage, UHC, that we talked about, what does it do? It focuses on primary health care, PHC. Again, PHC is a core concept if it is in public health. Primary health care. There are packages of primary health care. It might be different between countries, among the countries, but again, the concept is that there are some care, there are some aspects of care that are called primary, and it should be provided for the people at community level. So, for universal health coverage, the WHO focuses on primary health care to improve access to quality essential services. Quality essential services. For example, in the field of dentistry, it is logical that we think that if anyone in any part of our country has, for example, toothache, he or she should receive treatment. He or she should be able to receive treatment in a timely. The time is important. For example, if we don't have any facilities for oral health around the people, for example, I have toothache here, I'm in a region that there are no dentists, for example, till 200 kilometers away from me, then it's a problem. I cannot receive timely treatment. So the facilities should be there. I should have access, physical and financial. If I want to pay, if I have to pay, it should be at the level that I can afford it. This is essential health care and primary health care and universal health coverage and other health care services. Then WHO works towards sustainable financing and financial protection, because we told that for the UHC there should not be any financial barrier. So WHO tries to work towards sustainable financing. It tries to improve access to essential medicines and health products, trains the health workforce and advise on labor policies, supports people participation in national health policies. We will talk more about this when I think in your 5th semester, we will have some other public health courses with you, community rural health course. And at that course, we will talk about this, for example, people's participation. How people in a country can participate in, for example, policy making, in health policies, and so on. Then it tries to improve monitoring, data and information. This is for health for universal health coverage. For health emergencies, WHO tries to prepare for emergencies by identifying, mitigating, and managing risks, then prevents emergencies, support development of tools necessary during outbreaks. It detects and responds to acute health emergencies, and supports delivery of essential health services in fragile settings. For example, again coming back to dentistry and oral health, when there is a outbreak in for example, the flood, earthquake, even war, some people have tooth problems, oral health problems. There should be service available for them. Yes? And we have specific disciplines. It is health in disasters, I think. Health in disasters. It's a discipline for itself. So some people are trained in this discipline. And they are trained how to act during outbreaks regarding to keeping people healthy, providing health services for people that they are in the heart of the outbreak or earthquake or war or any other emergency situation. So, and then detects and responds to, okay, I told you, yes, delivery of essential health, we were talking about this one. So, this is another role and responsibility for WHO. And regarding health and well-being, it talks about social determinants of health. Can you name some of the social determinants of health? SDH, health. Can you name some of the social determinants of health?